Medical imaging using waves, the MRI. In 1971, Raymond Damadian proposed a machine that could function as a medical imaging process, which featured the use of magnets and radio frequency waves. In 1977, Damadian built his idea and named it Indomitable. Today, we know it as an MRI. An MRI is short for magnetic resonance imaging, and as the name suggests, uses magnets to produce cross-sectional images of the body. So how are magnets able to produce a cross-sectional image of your body? Well, we first have to look inside our bodies, particularly the hydrogen atoms in the water of our bodies, and even more specifically, the protons of these atoms. The protons in the nucleus of hydrogen atoms exhibit a magnetic field due to the proton's intrinsic spin. The direction of the magnetic field is known as a magnetic moment, which is a vector quantity and is determined by the direction at which the proton rotates. When the proton is placed inside another magnetic field, the magnetic moments are aligned parallel to the magnetic field. The orientation in which they are aligned in the magnetic field will either be parallel or antiparallel. When the magnetic moments are aligned in the same direction, they also experience a secondary rotation along their own axis. Imagine the proton is a spinning top. The top itself spins, but it also wobbles. This rate at which the top wobbles is known as the Larmor frequency. When a patient is placed inside an MRI machine, a primary magnet exhibits a magnetic field that aligns the protons within the patient. A radio frequency pulse, or RF pulse, is tuned to the Larmor frequency of the protons. It is then shot perpendicular to the magnetic field, which in turn causes the protons' magnetic moments to differ from the magnetic field by 90 degrees. As the RF wave is cancelled, the magnetic moments of the protons realign parallel to the magnetic field. The change in position of the magnetic moments emit energy in the form of nuclear magnetic resonance waves, or NMR waves. These waves are captured by a metallic coil in the MRI machine, and a computer then produces an image from this information. Using this technology, radiologists are able to scan for a multitude of diseases within the body and provide well-informed prognosis. MRI scan for brain and spinal cord anomalies, tumors and cysts, breast cancer, joint injuries, heart problems, and liver and abdominal diseases, just to name a few. While most other medical imaging processes are able to perform scans for these diseases, the process of the MRI and the images that are produced possess many benefits and attributes that other processes cannot achieve. For instance, it is non-invasive, meaning that no instruments have to be in direct contact with the patient, which allows people who have fears of needles, syringes, or any other probe devices to undergo medical imaging. However, in some cases involving the spread of cancer, a chemical agent is injected into the patient to form a color gradient, which creates clearer pictures. MRIs also don't utilize radiation, which removes the risk of cell destruction and the possible development of cancer, unlike X-rays which use ionizing radioactive waves. This is especially helpful for patients undergoing scans for cancer, as the risk of worsening or spreading the cancer is mitigated. MRIs are also one of the clearest and most accurate methods of medical imaging. Look at this comparison between a CT scan, which uses X-rays, and an MRI. The shape of the tissue and bone of the spine is more clearly defined in the MRI scan. This allows radiologists to examine the images more clearly and provide an accurate diagnosis. MRIs are also able to scan large portions of the patient's body and produce slices of cross-sectional images at every angle, which again allows radiologists to perform deeper analysis of the patient's body. If MRIs are so effective and accurate, then why don't we use it for all medical imaging? Well, for one, it's expensive. The average costs of MRI are reported to be around $2,600, but the prices range from $400 up to $1,300, depending on where the scan is performed. This means that people of low economic standpoints may not be able to access MRIs, limiting the amount of people who can receive effective treatments. MRIs also utilize large magnets to produce strong magnetic fields, which, when in range of metallic implants, may damage them or cause severe injury. This means that patients with any form of metallic implant, such as a pacemaker or a metallic knee rod, may not be able to receive treatment through the MRI. MRIs also require the patient to be in a confined and closed space for up to an hour, which may be concerning for nervous and claustrophobic patients. When searching for cancers, MRIs are not able to distinguish between a malignant tumor, a tumor that spreads, and a benign tumor, one that doesn't. In fact, no known medical imaging exam can detect malignancy of a tumor. As a result, MRIs can only be used to detect a tumor. However, a full diagnosis may not be made solely on the results, and a biopsy, where sample cancer cells are taken and studied, has to be conducted. This may incur further costs of treatment on top of the costs for the MRI scan. Whilst the MRI has reshaped the world of medical imaging, it does still have its fair share of shortcomings which make the MRI process imperfect. Its ability to collect accurate cross-sectional images of the body without being invasive or using radiation has made it superior to most medical imaging techniques today. However, its monetary cost and utilization of strong magnets excludes people with metallic implants or poor financial stability to receive treatment.